Welcome to the Connecting Citizens to Science podcast. We have a new participant here at Health Systems Global Day 3, which is actually kind of day 1 because the first 2 were kind of satellite sessions. And I'm here with Dheepa Rajan from the World Health Organization, and we have just been talking about terminology, but let's hear a little bit about who you are, your background, and then a bit more about the conversation we are having.
Thanks, Kim. Yes, my name is Dheepa and I am with WHO. I was with headquarters until very recently for 16 years. And in July I moved to the European Regional Office, specifically a sub-office based in Brussels called the European Observatory for Health Systems and Policies. This past decade or so I've been working on health systems performance, community engagement, primary healthcare.
Excellent. The community engagement angle, you were telling me a bit about, there's so much different terminology out there that we hear all the time, that you had a discussion about what language you would use. Can you talk us through that?
In the health space, specifically in the programmatic health space, when we're looking at malaria programs or HIV programs, often the term that is used is community engagement, probably because the focus is on engaging with a certain community, such as the HIV community or community of people affected by NCDs or whatever. So a certain community of people affected by a certain disease or who are part of a cohort. Like the term community engagement is quite anchored, I think, in the global health, public health space. We put out last year a handbook on social participation for universal health coverage. In the 2 years that we spent developing the handbook with an external and internal advisory group, we also reviewed the different terminologies used and looked at all the different definitions. In the end, we kind of landed on social participation because we wanted to make the point that this is about engaging with communities, but also with civil society sometimes as intermediaries, and sometimes just with the general lay public who may or may not be affected directly by a certain health topic. We thought that was a bit broader. The term social participation is broadly used in the Latin American region. In this region of the Americas, it seems to be quite anchored in a lot of the declarations, frameworks, resolutions around PHC, primary health care, and universal health coverage, and the essential health, public health functions. All of those documents, you'll see the term social participation. There are regions within the WHO network that prefer the term participatory governance. It goes back to the fact that governance is something that's seen to be largely done by governments. Since we're a member state-run organization and we mainly work with our member states through governments, through ministries of health, this is the term that tends to be preferred, at least in the health systems space. When going to the programmatic departments, they often still use community engagement. There's a large variety of terminology. There's a lot that I haven't even mentioned. We did a whole review of definitions, which is in the chapter 1 of our handbook on social participation for universal health coverage. But these are the 3 I think that are most relevant at the moment.
That's fantastic, thank you. There's new terminology there that we don't use so much. It's really good to understand across the world how we use language and what it means as well. Tell us more about the handbook. That sounds very interesting.
So the handbook, we released it last year, 2021, and it was preceded by about 2 years, more or less, worth of research. It was steered by an external advisory group, which we call the Social Participation Technical Network, and then also an internal group of WHO experts working in the topic because, as I mentioned previously, a lot of the expertise and experience in this realm of community engagement comes from the vertical programs. We had people in that internal group from the malaria department and the HIV department, etc., and they have long-standing experience working with communities. Then we did 9 case studies where we did primary data collection in 9 countries in all of the different WHO regions. Then we did about 8 literature reviews. The point of this handbook was to target policymakers in the how-to of participation. What we see is a huge capacity gap among policymakers, mainly because policymakers in the health space tend to have quite a medico-technical background. This is not something they've been trained to do. They haven't been trained to engage with people. They haven't been trained to listen to what experiential knowledge and translate that into something that's policy relevant. That's exactly what this handbook aims to give guidance on and support. How do we organize a participatory space? How do you think through whom you invite? What is representation? Who represents whom? How do you define your policy question that you want to discuss in that space? What is the format and design that you use? There's so many options. There's citizens' juries, free-for-all, open mic sessions. There's more deliberative processes like citizen panels. There's so many different formats and participatory space design that you can use. It's a bit mind-boggling to figure out which ones you should use for which topic and how.
The handbook sounds amazing. I also love the fact that you've designed it for policymakers by the sound of it. A year on, you released it last year. What is your feeling? Are policymakers using it? Is it working well?
We do get quite a few country requests for support where we go in and see what the policy process is and see how we can build in participatory processes into that process. The largest obstacle that we still face in countries is political will for participation. So there's often this vague idea that, okay, we need to do some civil society consultation or we need to bring in communities into this process, and that's where we get the requests. Then when you actually go into countries, you see reluctance on certain aspects of the participatory process, or people or policymakers realize that it takes some time, that you have to invest in it, and the process has already started. The political will issue is a challenge, and that's why one stream of work that we're working on is to move towards a World Health Assembly resolution in a couple of years. We're working now region by region to get buy-in from member states for regional committee resolutions to then feed into a World Health Assembly resolution in a couple of years. The point of that is to engage with member states at a higher level to get the political will. At the same time, we're trying to work with civil society organizations also through the UHC 2030 civil society engagement mechanisms and other platforms, because WHO doesn't necessarily have those platforms to work directly with civil society. We have to work through other platforms to work with civil society to support more grassroots type movements so that it's top down and bottom up together. Hopefully that will bring about some more political will to actually invest in participatory spaces. Most countries are okay with the principle of participation and agree to it, but when it comes to going from the principle to action, we haven't seen so much action on that. There's exceptions and there's some good practices here and there, a lot of ad hoc participatory spaces or processes happening. We want to see something more regular, frequent, institutionalized. We're not there yet, but I'm sure we'll get there.
That sounds really good. It's useful to hear how you're tackling that political agenda in different ways, so that's fantastic. So here at the conference, you've been presenting the handbooks, and I've seen you in many sessions. How are the sessions going for you? Are you talking to lots of people? Are the conversations developing?
It's exciting to be here because we haven't seen each other in person for a long time. So it's great to see a lot of colleagues and people that we've met only during the pandemic online, and to see them here and to talk about intensifying our collaboration in our common goal. There is increasing interest in community engagement and social participation, partly, I think, stimulated through the COVID crisis, where that aspect has come out as one of the key defining issues of whether the country was successful in its COVID response. It's great to see this topic of community engagement and community connection being woven through the different sessions.
I've seen many sessions around power as well and participation and really unpicking that. I think there's a real thirst for change there. You mentioned case studies right at the beginning in the handbook. Have you used those case studies, and are they powerful in creating that political will in different contexts?
Yes, partly. I mean, especially the best practice case studies, some of typical best practice examples, countries that are doing this quite well. We use them to kind of give other countries something to orient themselves towards, to have that documented in detail, exactly how they've done it, how they've put their process together, how do they get their funding, how do they select their participants. That's been really useful in knowledge sharing and knowledge brokering. And in country as well, with these case studies, we've tried to also feedback sessions in countries to make sure that the results feed into something at the policy level. We finished the case studies around COVID, when COVID hit, so we didn't do them as intensively as we wanted to because we were all grounded at home. Now we're trying to get them out, publish them, have the published piece be the object of a sort of policy dialogue.
Last question before I let you get back to the conference. We like to end a piece of advice for people that want to engage communities. What would you give them?
I think the first thing is to understand who your community is and get a sense of who they are by first informally engaging with them, to get a sense of who they are, what are their issues, what's their language, what are their concerns, and bring them on board in that development of your community engagement process. That's often easier said than done. What I found to be quite helpful is that early on through the informal engagement, you can find out fairly easily who your champions are and who your intermediaries will be, who has the trust of the community, and that can be sort of the person or people or institution that you work with and go via, so to speak.
Trust has come up in a lot of our interviews throughout this and also throughout the podcast. Nearly every episode talks about that importance of trust. Thank you so much for joining me today.
Thank you very much.